The drug I chose to do my research was on OxyContin. It is also known as blues. This is a highly addictive drug and should never be shared with anyone else. And you should never give this drug to somebody who has previously been addicted to drugs. You should never consume alcohol while taking this drug, and you should also be careful once you're taking this drug and take it as directed. Do not take any more. Also, you need to be careful with driving, and you should see how your body reacts to it because it can impair your reaction time and your thinking. And also, once you're done taking this drug, you should contact your doctor to see how you can safely get off of using this drug. OxyContin is a pain medication. It is an opiate and it is also a narcotic. This drug is used as a painkiller. It's used for a long term for to alleviate moderate and severe pain. Before taking this, you should inform your doctor if you have liver or kidney disease, low blood sugar, mental illness, a history of drug or alcohol addiction, trouble swallowing pills, epilepsy, asthma, or anything that affects your breathing. This drug is not known to harm your unborn child. However, if you do take it while you are pregnant, your newborn child will have breathing problems. It will be born addicted to the drug, and it will also have withdrawal symptoms. And also, if you are breastfeeding your newborn child, this can also be passed through, so they do not suggest you to breastfeed while taking this medication. The use of medication, you always want to make sure you keep track of your pills, especially if you know somebody who has a drug addictive problem or if they are addicted to painkillers. And you should always make sure you receive the correct number of pills. And also, when you are done taking the pills, you should flush the rest of the pills because the FDA says that this is the safest. So this way, you don't continue taking the pills as not needed. If you do miss a dose, you should take the next one as soon as you realize that if it's close to your next dose, you shouldn't take both of them at the same time because that might cause you to want to take more than directed. Also, you should only take as much as you are subscribed. You should never take any larger amounts because this can lead to addiction. When the meds stop working, you should inform your doctor because this way you don't take more, because if you take more, your body's going to build up an immunity to it, and it's a greater chance of you getting addicted to it. Also, you should swallow this pill whole. You shouldn't crush it up. You shouldn't mix it with anything. You shouldn't try and do anything of the sort with it. For an overdose, overdoses are extremely fatal, and they can lead to death. The symptoms of an overdose is extreme drowsiness, confusion, shallow breathing. You could faint, you can go into a coma, you can have weak muscles. Also, your skin can become cold and clammy, and also your pupils will be pinpoints. You should avoid taking alcohol again and driving any machinery or anything like that. Alcohol can intensify the feeling of this drug, and it would be like you're taking more than directed. You should also avoid taking any other medications with this. You shouldn't be taking any other narcotics. You shouldn't be taking anything that makes you sleepy or drowsy, any type of pain relievers or sleeping pills. Some side effects, you want to stop using this if you are or if you get any seizures, or if you feel as though you're confused, feel as though you're about to pass out, if you have any severe weaknesses or severely dizzy, you have shallow breathing, and your heart rate is slowing down. Common side effects are nausea, vomiting, constipation and loss of appetite, itching, sweating, dry mouth, drowsiness, headache, and extremely tired and sluggish. Signs of being addicted. You're always thinking about when to get the drug, when to get your next fixed. You're getting it illegally. You're having a prescription for it. You feel pains that aren't even there because the way that your muscles are reacting to it, because your body hadn't built up an immunity to it. You would do anything to obtain more drugs, like stealing, lying. You also distance yourself from your family because you're hiding the fact that you're doing drugs and you don't want them to know that you're doing it. And also you could be nodding off, sweating, it'd be extremely calm, sluggish, itching because you're fiending for that next fix, and also causes nausea and vomiting. Tolerance, pretty much your body builds up an immunity to it, and you need more in order to receive the same high that your body has been getting before. Your body becomes dependent on this drug. Withdrawals, you become sweaty, agitated, feel pain, you have chills, depression, can't sleep, and yeah, that's